And this is also a little bit close to the fear of falling. But now think, machine or devices or exercise, which one would you choose? First, we have standing machine, and at first I want to ask that have you stand on a standing machine? Do you know how it feels like? Do you know how good support is the standing machine? So when you or the patient is on the standing machine, you can lean on it. You don't need to do much work. The machine is so good. And the standing machine is taking care about the center of mass. And because of the standing machine is taking care of the center of mass, I am asking that what the brain is learning. Also, why we need to rush to stand. The all lower positions has significant meaning for our COM, center of mass, and learning skills. If a normal child is crawling before standing, why we are putting our GB children and stroke adults to stand before they have learned to be on knee standing? Or crawl or something. I think that it is good if we are also in the lower positions. There's no rush. The quality of the standing is much better and it's automatic if you use your time in lower positions. So, do you choose standing machine, or you can make the patient independent on the floor without fear of falling to prepare the patient for biped gait? And you can choose which is good for your patient. Is the patient doing Buddha sitting? Is the patient doing knee sitting with assistant or by him or herself, or one knee standing? But these are also good postures. If the patient can be independently in these postures, it's much more important than being in the machine. And I would like to remind you that Vasa Concept's goal is also to get patient walking. But we want to see only good quality walking. We don't want to see the bad quality hemi walking. We want to see only good quality walking. And when you do these postures and all Vasa concept exercises what your patient need to do, you are able to get into good quality walking. And then next is ankle support. I hope that you have tried how this feels like. Ankle supports are usually keeping the ankle about 90 degrees. And if you have put the ankle support on your own leg and try to walk with it, you will know how much that is affecting the walking. And it's affecting in the whole body, not only the lower limb. But it changes the whole movement in the lower limb. You can try it. How it is different when the ankle cannot move. And does it help to activate the right muscles when you have the ankle support? So, do you choose ankle support or activate your ankle automatically and say bye-bye to spasticity without medicines or surgery? And here is 2 good postures which you can use with your client. And first one is the duck or squat. And you can do those with or without support. And the squat and duck is very good position for reducing spasticity. Very good. And also this bear or camel position with or without support. And you saw from the video that sometimes there's many people assisting at the beginning. But usually it gets easier and easier all the time. But with these 2 postures you can start to activate the ankle. And I hope that you start these postures as soon as possible after the stroke, that a patient cannot develop spasticity on the ankle or contractures. And or on the other parts of the body. But start these as soon as possible. And then we are going into hand orthosis. Usually orthosis keep wrist about 0 degrees. And when the wrist's normal passive movements is getting less and less, you cannot move your wrist when you have the orthosis. So they are getting less and less. And some orthoses are even stimulating to squeeze, like this one in the up here. And you can test that also. But when the patient is having stimulation in the palm of your hand, it will attract you to squeeze. You can try it also. If you take something on your hand, or if you are putting your hand, the orthosis like here on the up here, and try it. And try not to squeeze it. Not at all. No squeezing. How hard it is not to squeeze if something is in your hand. So, if there's orthosis, you need to think closely what kind of like orthosis is good. And are these orthoses helping muscles to activate? So, do you choose hand orthosis or do you help the patient to exploit gravity on upper limbs? Here are only some postures, but these postures you increase the patient's passive and active trajectory and active and passive movements. And these are so easy to do at home. And you can always give guidance to the family members that they can also do those at home. So this is about what you are choosing and what the patient is choosing. But you can always do something. And like this exercise you can also do over the bed. So it's good also for geriatric patients.